Good afternoon to everyone. I am Natalie Gemlokias. I am gonna use PowerPoint presentation and demonstration as my teaching strategies. My topic to discuss today is about vital signs monitoring and recognizing and managing deteriorating patients here in the United Kingdom. So the objectives for this presentation are first, to be able to recall and learn the basic skill in taking vital signs to patients. Second, to be able to learn the proper recording of patients' vital signs. Third, to be able to recognize and thoroughly manage deteriorating patients. And fourth, to be able to escalate deteriorating patients with relevant information and details. Let us start with the vital signs monitoring. This is just a recall of what we learned on how to take vital signs. I have here a short video on how to take vital signs. So my topic today is about vital signs monitoring. When we say vital signs, this includes blood pressure, pulse rate, temperature, breathing or respiration, and oxygen saturation. In taking blood pressure, we normally use the normal blood pressure cuff and the stethoscope. But in the hospital, we're now using this automatic blood pressure monitor. We can see here the body of the monitor and then the cuff. We can operate this monitor with batteries, and if not, we are to attach it to its adapter and plug it to the outlet. Then we will attach the cuff to the body of the monitor. Before putting on the cuff to the patient, we need to make sure that the patient is relaxed and quiet for the moment. Patient's palm should be facing up, then we will place the cuff right above on the patient's elbow of the bare arm. Wrap the cuff properly around the arm. Make sure that it will fit one finger inside. It should not be too tight nor too loose. Now, we will press the start button, and the display will show dashes as it indicates the data is transmitting. Remind the patient to remain still and relax. At this moment, while waiting for the result, we can check the respiration or breathing of the patient. Look onto the patient's chest for the rise and fall. Count the breathing for 1 whole minute. When the blood pressure reading is done, we can see on display the systolic and diastolic as well as the pulse rate of the patient. You can also do manual checking of the heart rate or pulse rate by placing the tips of your index and middle finger on the inside of patient's wrist below the base of the patient's thumb. Place the thermometer properly on the patient's armpit to check the temperature. Then place the pulse oximeter to the patient's thumb or any finger for the oxygen saturation. Now, let's move on to another topic about recognizing and managing deteriorating patient. Changes to vital signs, behavior, and mental state often occur before a serious event, such as cardiac arrest. Being able to recognize and act on these changes are essential skills to improving patient safety and outcomes. In the United Kingdom, they developed a program called Recognizing and Managing Deterioration to support the workforce and organizations in ensuring staff have the necessary knowledge and skills to recognize and manage deterioration in adult patients. The program includes resources on the National Early Warning Score or NEWS2, which is endorsed by NHS England and NHS Improvement for use in acute and ambulance settings. Failure to recognize and appropriately manage deteriorating patients is a contributing factor in managing many adverse events in hospitals and healthcare organizations around the world. NEWS is a simple scoring system that allocates a score to each physiological parameter, which indicates how that parameter varies from the norm. Higher scores indicate worsening physiological derangement. There are 6 physiological parameters which form the basis of the scoring system, plus oxygen uplift. These are the respiratory rate, or RR, oxygen saturations, scale 1 or scale 2, blood pressure, pulse, consciousness, and temperature. So this is the NEWS observations chart. So this is the chart to use to record all the vital signs that were measured. So each parameter is allocated a score each time the news is undertaken. The vital signs should be taken in the order displayed on the chart, which is based on an airway, breathing, circulation, disability, and exposure assessment. So there's a section here, SpO2 scale 2. This is for use in patients with hypercapnic respiratory failure, usually due to chronic obstructive pulmonary disease or COPD, who have clinically recommended oxygen saturation between 88 and 92%. But the decision to use this SpO2 scale 2 should be made by a competent clinical decision maker and should be recorded in the patient's clinical notes. But in all other circumstances, the regular news SpO2 scale 1 should be used, this one. So let's take this as an example. For the respiration, we have 20, so it's plotted between 18 to 20 row. Then for the SpO2, we have 96% on room air, and the blood pressure is 140/70, heart rate of 80, patient's alert, and the temperature is 37 degrees Celsius. So we see here, so for 20, the score is 0, 96% also 0, room air 0, blood pressure, we're looking into the systolic, so it's 0. Then for the pulse rates, it's also 0. The consciousness alert is 0, and the temperature is also 0. So the new score in total is 0. So our monitoring frequency, we have it every 12 hours. Escalation of care, no, because the patient's stable, and you will put your initial at the bottom. So this is the new scoring system chart. So this new scoring system chart shows the weighing for each of the parameters more clearly. So this is very useful for those who are new to the news, as it is a quick reference guide to the scores allocated. So this is the clinical response to the trigger threshold. So this one, the clinical response to the news trigger thresholds advises on what to do with your news once completed. So there are local variations on this in pace. So decisions will also be made on an individual basis for patients with chronic long-term conditions who may trigger each time their vital signs are done. So example, earlier we did news score of 0, so with the frequency of monitoring will be a minimum of 12 hours. And the clinical response is continuous monitoring. But if the news score is like 1 to 4, there's minimum frequency monitoring of 4 to 6 hourly. And then there's corresponding clinical response to this side here. Inform registered nurse who must assess the patient, and registered nurse decides whether increased frequency of monitoring and or escalation of care is required. If the news score is 3 in each parameter, there's a minimum of 1 hourly frequency monitoring, and registered nurse to inform medical team caring for the patient, who will review and decide whether escalation of care is necessary. And then if the total is 5 or more urgent response threshold, minimum of 1 hour monitoring. So registered nurse to immediately inform the medical team and caring for the patient, and registered nurse to request urgent assessment in the care of acutely ill patients. So provide clinical care in the environment with monitoring facilities. And if total is 7 or more, so that's really needs continuous monitoring for vital signs. So registered nurses need to immediately call or inform the medical team caring for the patient. So this should be escalated. So emergency assessment by the team, the care competencies including the practitioner with advanced airway management skills, and consider the transfer to a higher level of care, which is an ICU, and a clinical care in an environment with monitoring facilities. So we have here an escalating concerns using the S-bar. S-bar stands for situation, background, assessment, and recommendation. So this is a communication tool that is used to help frame conversations. So the S-bar tool can also be used by members of the healthcare team as a focused way of transferring information about the patient's conditions. So this is an example of how to do the S bar. So for the S, so let's say I am your name, the nurse name blank, the X nurse in the ward, which ward is that, and I'm calling about the patient X. I am calling because I am concerned that, example, the blood pressure is low or high, pulse is high or low as well, the temperature is also high or very low, and the early warning score is, so this is the new score of the patient. For the background, example for this is the patient X was admitted on this, which ward, and with example MI or chest infection, and then they have had operation or procedure or investigation, and then patient's condition has changed in the last how many minutes. Their last set of observations were, so you would say that the patient's X-normal condition, example, before it's alert and now become drowsy, confused, or pain-free. So that's the one. Then A for assessment, example for this is, I think the problem is this one, blank, and I have, example, given oxygen or given analgesia for pain, and or I stopped the infusion, or we can say I am not sure what the problem is, but the patient X is deteriorating. Or we also can say I don't know what's wrong, but I am really worried. So what's under assessment? And for the recommendation, we will say I need you to say come to see the patient in the next how many minutes, and is there anything I need to do in the meantime, example, to stop the fluid or repeat the observation, and ask the receiver to repeat the key information to ensure that they understand what you say. And that's the end of my presentation. I hope you learned something, and if you have any questions, feel free to ask. Thank you so much again, and have a good day.